Good afternoon and welcome to this Bhekisisa Center for Health Journalism webinar. I'm Bhekisisa's editor, Mia Malan. Today, we're going to go inside South Africa's COVID newsrooms, and you'll get to meet 5 influential journalists and editors who all either report on the pandemic or manage reporters to do just that. And we're going to look at how these media professionals make decisions about COVID stories, how the digital vibe scandal and the national vaccine rollout have influenced their jobs, and you'll also get to hear what they see on the front line. I'm very excited about our panel because our 5 speakers cover a wide range of media in South Africa, from the Daily Maverick to Eyewitness News to television stations such as ENCA and Newsroom Africa, and of course also non-profit media such as Bhekisisa. So I'm going to introduce our panelists when they speak, and mostly only with a name and title. But if you would like to know a little bit more about them, you can read their bios on our website. We've just added the website link to their bios in the chat box on Zoom. I'm going to start off by asking each panelist a question to which they will respond in about 5 to 6 minutes. And then after that, we will move on to a question and answer session to have your questions posed to the panelists. So please do enter those questions into the chat box on the Zoom channel. And also, if you are joining us via YouTube, you can leave a comment or a question on Bhekisisa's YouTube channel. We will keep an eye on that. We're live tweeting this event. Joan van Dijk from Bhekisisa is on duty for this. So if you'd like to follow our tweets or retweet them, please go to our Twitter handle. It is at Bhekisisa_MG. It's also in the chat box on Zoom. And if you would like to live tweet this event yourself, we are using the hashtag Bhekisisa webinar. Before we start, please, if you are not a panelist, mute yourself and turn off your video so that we save the bandwidth and so that we have reception that is as good as possible. So we're ready to start with our first speaker, which is Heidi Jokos from ENCA. Many of you may know her face. Since the start of the Sisonke trial in February, Heidi has been reporting live from COVID vaccination sites almost daily, and she's been pretty remarkable. She's a financial journalist who was thrown into the deep end, having to switch to the health beat practically overnight, and she's been doing a really great job of that. So Heidi, tell us, what are you seeing on the front lines? How do you protect yourself against infection? And have you experienced any challenges in getting information from the health department about the vaccine rollout?
Sure. Thank you so much, Mia, for this fantastic opportunity. I think it's so crucial that we tell the story of what we actually go through, on the front line, being exposed every single day. So yes, as Mia introduced me, my name is Heidi Jokos. I'm a reporter for ENCA. And I've basically had to switch beats overnight. It's been really tough. It's been really challenging. I remember the first day that we heard about the first COVID case in South Africa. I was running around the newsroom so panicked, and everybody told me to just calm down. And almost a year later, and look where we are. It's been extremely tough. I had contracted the virus in July. It's almost a year since I've had the virus. And every single day, I worry and panic that I could possibly get it again. Of course, you try your very best to be as careful as possible, but this virus is everywhere. And even if you are careful, if you are exposed every single day, there's a chance that you could possibly get infected again. But as much as it's been extremely challenging, it's been very encouraging to see how everybody has come together. It's a very strange and uncertain time that we are in at the moment. But since the vaccine rollout started, that's when I've been more and more thrown into covering COVID-19 and the vaccine rollout. I was telling my editor earlier on today that for the past 6 weeks, I've done vaccines every single day. I actually dream about vaccines. That's how much I talk about it and how extensively I've covered it. And some of the challenges that I've picked up is the fact that there is no access to information, particularly in Gauteng. It's been an extreme challenge. I think when people see me from Gauteng Health calling, they probably roll their eyes because there's a constant battle to try and get access to information. When are the vaccines arriving? How many are arriving? What are the elderly supposed to do? And this is something that really was shocking for me. When phase 2 kicked off on the 17th of May, it was almost like nobody knew how this was going to pan out. So access to information has been extremely tough. It has not been easy. But as the vaccine rollout progressed day by day, I started noticing that things were running a lot smoother. The elderly and senior citizens were getting assisted much quicker than the first probably week or so. And many of them had been very fearful about getting the COVID-19 vaccine. All the misinformation, disinformation about if you get the vaccine, you're not going to survive. But what's been positive and encouraging is the nurses on the ground, the hard work from healthcare workers on the ground, trying to make sure that everybody is well informed. Some of the other challenges that I picked up on the ground was the fact that some people took the advantage of cheating the system and registering as a healthcare worker when in fact they were not, and they managed to get the vaccine, which was very discouraging because, there are people that are more vulnerable and more at risk, and we should wait our turn before we get the vaccine. What I also picked up was the fact that in the beginning of just before phase 2, when Sisonke was ending, it seemed as though there was miscommunication and the elderly were getting vaccinated when it wasn't their turn and they were forming part of the Sisonke trial, which of course is going to have a negative impact on studies and the outcome of that trial. But that's just some of my experiences. It hasn't been easy. There have been many moments where I've been very frustrated, very emotional, just seeing what people go through every single day. It has not been easy. And as a journalist, you have to remain neutral and objective. You have to remember that you're trying to tell the story, you're trying to inform people. And if I've learned anything from Mia, it's that facts matter and numbers are extremely important. So that's something that I've definitely had to master and make sure that I get it right all the time. There's no room to, make a mistake with numbers, because people depend on information from journalists, because there's just no access to the information from anybody else. I just want to make sure that I haven't missed out anything. For example, Mia touched on the fact that, how is the digital vibe scandal affected all of this, and just covering this from the very beginning and being around the health minister that's now on special leave. It's been tough getting information. And when I was in the Northern Cape, just before the health minister was put on special leave, it was difficult to get the information out of him, but he eventually answered. And it's so crucial that in a time of such uncertainty, we need to have information on hand all the time. But it's been a great pleasure to report on this, and I hope that people see us as a source of important information, because I know how overwhelming it can be. I know how difficult it can be. But that's been my experience so far. And I was actually laughed at yesterday because somebody said to me, "But why are you wearing 2 masks?" And I said, because I'm so scared I get COVID again. And because I'm so exposed and I stay with my parents and they are elderly, I have to be extra careful. So just seeing what's happening in Gauteng, we have to be responsible and we have to be cautious, especially as journalists, because we're everywhere all the time.
Thank you very much, Heidi, and thank you for being so honest about the challenges that you've experienced, but also the good things that you've learned. Our next speaker is Mkhlatsi Mkhlasi, who is the Group Editor-in-Chief of Eyewitness News, and she's also the Secretary General of the South African National Editors Forum. Now, Mkhlatsi has a really interesting background because she has been both a health reporter and political reporter and editor. And it's almost like a background is tailor-made for this pandemic, because it's both consisting of health and politics. Maglatli, and now you are the head of a newsroom where health and politics have collided because of the pandemic. Has COVID changed the type of stories that your newsroom produces and the skill set that you require from reporters?
Good afternoon, and thank you very much, Mia, for having us. And good afternoon to everybody, my fellow panelists and everybody who's on this call. I think it was going to be expected that the kind of stories that we cover would change because we're in a pandemic. And this is a once in a lifetime moment for all of us in South Africa and in the world. So as expected, when you're covering something like COVID that affects all aspects of life, whether it is our social interaction with each other, whether it is the economy, and of course will always extend into politics because nothing in the world escapes the realm of politics. It was going to be at the center of all of our coverage. I think that the one thing that I wanted to just highlight is around how managing a newsroom during a pandemic is actually quite challenging. One of my biggest things right now as I sit here is that my newsroom is fairly quiet. I have journalists that are busy working, but our newsroom is quiet because on the onset of the pandemic, we took a decision for people to work from home. And I miss the loudness of a newsroom. I miss those moments where we have journalists shouting, arguing at each other, shouting their frustrations because a newsmaker is not available, or basically saying, please help me. And, you know, most of my lifetime, that is how a newsroom has always operated. Now people are not in the office, they go out on their stories and file from where they are. Yes, technology has made that possible, but we've had to really change how we work as a team. And that can be also very difficult, especially for me as a manager, because you don't have that daily chance to meet with your reporters and see them. And when you are dealing with a pandemic, they are also people. You worry about when they go out on stories and the risk of exposure. So every time you assign somebody to leave their home and go and cover, whether it's a vaccination site or it's what a hospital looks like, or even just a press conference, you actually are saying a silent prayer to say, can they be safe? And you know, you scream and shout about, do you have your mask on? Are you sanitizing? But we know that every time you're exposing people to people that they don't usually interact with, you're putting them at risk. So that is the one big worry. Also, journalists are people. All of us have had to deal with the anxiety of living with the pandemic. They are also people, so you worry about their mental health. They worry about their own family members and how they are doing. And that has been one of the biggest challenges for me as a manager, just helping the team manage and navigate the challenges and the impact on their mental health. And does it need a new skill set? I think, you know, when the pandemic hit, we all went into a panic about, do I have a specialist health reporter? Do I have a specialist science reporter? Because I think those are two different things. But I think when we actually got to calm down, and I use this as an example, do you remember scientists telling us that don't wear a mask because, you know, you need to leave the mask for the health professionals, or we can't prove that the mask actually protects you? The scientists have also been learning on the go. And then you start realizing that, like every other story, always find more than one source, because we are actually hit with a new pandemic and the science will change every single day. What is important is to follow journalism 101. Are you speaking to more than one people? Do they represent different institutions? Do they have a different view on how things work? And once we started doing that, I think we were a lot more confident in the kind of work that we're doing. And also just remembering that our audiences are not interested in the big scientific words. They just want to know, how is this going to affect me and how can I react and protect myself? And that's when you realize that when you put yourself as the listener, as the reader, then it's a lot easier to do. But what is important is journalism 101. Make sure that your internal systems of fact checking a story, somebody subbing, giving a second eye, removing your biases, etc., are in place, then I think you are much more better. It just means that you might be slower in producing the story because it needs to go through more intense interrogation because of the information that is not as easily digestible. But at the end of the day, when you have reporters that are committed, do read, and you have the editors that support them, I think that we learned that we can actually cover this pandemic.
Thank you very much, Bhekisisa, and thank you for highlighting the mental health aspects specifically of reporters that we don't talk about so often, but there's such an immense impact on how we operate in a newsroom and, you know, the impact of working in isolation or not in a group. And now we're moving on to someone who does work in isolation because she's based in a province, the Eastern Cape. Estelle Ellis is a senior journalist at the Daily Maverick, and she's been telling health stories from the Eastern Cape for years, if not decades, Estelle. And not so long ago, before she joined the Daily Maverick, she told them for the Eastern Cape Herald. Now, Estelle, you are based in a province with probably the most dilapidated health system in the country. And now we're rolling out vaccines within that system, and we're also in a third wave. How well equipped is the Eastern Cape for our vaccine rollout? And how do you make story decisions about what to cover, COVID related, when there are so many other competing health systems, things that go wrong in the Eastern Cape health system? What's your experience from the ground, and what are you seeing, and what are your challenges?
Thank you, Mia. Good afternoon. Yes, so earlier in the year, the Premier decided that those nurses and health workers who were employed to help out with the second wave, they were actually redeployed to help with the vaccinations. So we started off very well, but this is something that happens in the Eastern Cape Department of Health. So we had a few moments with the cameras and the TVs, and everything was going well. But now it appears to me that vaccinations have slowed down fairly considerably. We are worried this is never going to be an easy province to vaccinate. It's very rural. There are not always road access everywhere. We're struggling maybe with transport. I know some of our vaccinations were delayed because of a storm, but most of the vaccination sites that I have visited are run by veteran nurses from primary healthcare. They run them like sergeant majors, and they're doing well. It's nice to see the empathy for the older people that are there. And I like the can-do attitude. You know, if I've seen people who came to ask just what's going on, and then next thing they know, they've been registered and vaccinated and sent on their way. And I think those things it's important that the vaccination sites are allowed to do those things in our province, that it's not so super managed. Of course, the delay in getting the Johnson & Johnson vaccine to South or released is huge for the Eastern Cape. I think the Premier's special consultant, Dr. Tobile Mbengashe, who is the former Superintendent General of the hospital, the man who seems to know all the challenges in the province quite well, he has said that, look, Johnson & Johnson will be the workhorse for this pandemic, for this vaccination drive. It's difficult for them to use the Pfizer in the far-flung rural areas. We saw for Sisonke, a lot of health workers took the lead by going to the communities, not waiting for the communities to come to vaccination centers. So yes, I think it was always going to be a struggle. It is a huge struggle to get information out of the Eastern Cape Department of Health. I've become so used to it, I forget. So sometimes when I start to think about it, like, no, this is terrible. There's not enough information. We do not get updates anymore on the number of vaccines. Sometimes the numbers of the departments, the National Department and the Eastern Cape Department, those numbers are not the same. So we are relying on a lot of, you have to have good contact. So we're relying a lot on the ground reporting to see what sites are open and which ones are not. It's a very, in some senses, it's quite a joyful thing to do, because we, for instance, today they opened the Middelburg vaccination site, and the nurse in charge sent this long list of instructions. People can just come, bring your ID and a phone number, and we'll register you and we'll vaccinate you. And just bring food if you're going to feel bad if you didn't eat, but don't bring food for everybody, just for yourself. And it's so nice to see these sort of human touches. You know, it's, for me, I'm very much a field reporter. I go out to all these places, and it's nice. You know, the Eastern Cape people are wonderful people. You get all these old ladies, they're bringing samosas for everybody, and cupcakes and sandwiches. There's so much food at these vaccination sites that I don't think anybody worries really about waiting. And but yes, I think it's going slow. I think it will likely speed up when we get access to the Johnson & Johnson vaccine, but at the moment things have slowed down. We get bizarre stats, like on a Monday, 3 vaccines. Now, you know, then we haven't had stats since Thursday, and then you think, how can they possibly have only vaccinated 3 people on a Friday or whenever? But yes, we are, I want to agree with Heidi, we're really struggling to get good information. But you have to go look for it. And as I said, I think it was a good decision to sort of almost decentralize the way these vaccination sites are run, and they run well, the ones that are there, and they are the ones that are up and running. Things are going as well as they can, because they don't have a lot of stock at the moment.
Thank you very much, Estelle. It's really interesting getting a view from someone in a province that's not that well equipped, but who still can see positive things happening. And also, thank you for being honest about the challenges with getting information from the health department. We'll talk a little bit about that in the Q&A session as well. Our next speaker has a political background, and Zain Samar is the managing editor for Input in the Newsroom Africa newsroom. And he has been looking at this story as from a perspective as a political journalist. Zain, your newsroom traditionally covers politics more often than other stories, and then COVID happened and it changed things for you. How do you make decisions in the newsroom? And if you look at, for instance, the digital vibe scandal, we now don't have a health minister that we used to have as a result of it in the middle of a pandemic, and we are dealing with a health department that has 150 million rands less to spend on communication. So do you think this digital vibes tender complicated COVID reporting, and how has it impacted on the health department's ability to communicate with the news media and newsrooms such as yours?
Thank you for the invite, Mia, and good afternoon to the panelists and to the participants in this group. Thank you again for the opportunity. Yes, I think COVID-19 couldn't have come or arrived at the worst time for journalism, in fact. The state of the newsroom from 2013 to 2019, in a report commissioned by SANEF and done by Reg Ramney, showed that the journalism steadily shed jobs over the past decades, stemming from the economic downturn of 2008. Now, COVID comes at a time then when journalism and newsrooms are faced with particular kind of dynamics. The issue of credibility, the issue of access, the issue of some units being politicized for factional uses in political dynamics. So COVID couldn't have come at the worst time. What COVID then did was to exacerbate some of the already existing challenges that we had experienced. So for instance, all of a sudden, access to the health department and getting news out fast enough from that department became quite a tedious exercise, because you now had a middle person who was actually that you had to contact to get hold of the minister. Like, for instance, when the story broke about the minister giving his first briefing, the health minister giving his first briefing about his involvement and the scandal with Digital Vibes that the department had become embroiled in. He came out with that statement at 23:30 in the evening. Now, to give newsrooms that kind of heads up is quite scandalous, because it meant for us as a newsroom who doesn't necessarily have a representation in the Northern Cape, it was difficult to get to that story. But that's just one of the very, I think, overt examples of how difficult it has become to access information from the health department. And I think also the health department has taken it almost as if they are responsible for each and every decision. And rightly so, because we as journalists, as newsrooms, have been holding them accountable. And so I think the politics have quickly almost suffocated COVID-19 and COVID-19 reporting. I think the Digital Vibes scandal is another example of how corruption is not just don't just happen in normal kind of mill of the run of the mill stories, and when we're not faced with a public pandemic. In fact, the public global pandemic has, in my mind, opened up various other channels for those who are interested in kind of corruption. So yes, it has impacted largely, and it has forced us to fuse the two stories, because today in South Africa, you can't, for instance, report about the numbers without reporting about the politics of not having a health minister present who leads from the front, and what that means for the health department. So when we do a story about COVID, we have to, in essence, do a story about the politics of that. We've seen now with several political leaders politicizing the vaccinations and what vaccinations we are using. We've seen some political leaders coming out and using some of these issues in the public space for political ends. And those are some of the examples that have forced us as a newsroom to think about how we cover the stories around COVID. And in fact, that most of these stories have become quite politicized, whether it's the rollout of the vaccination, whether it's the inefficiency of the hospital system to deal effectively with the number of rising infections, whether it's the Sisonke or the relationship between business and the health department, which seemed to be at the start of COVID quite a stable and working relationship, seems to me, at least, to have deteriorated. You have had several key people resigning from key positions. You don't see the business community as much involved in some of the rollout programs. So definitely, Mia, it has affected the way in which we cover politics and the way in which we cover COVID and politics. And I just want to take this opportunity to further sketch some of the contextual or the historical contextual problems that newsrooms have been facing as a result of the onset of COVID, because COVID also provided another opportunity to exacerbate one of our existing problems, and that is the onset of fake news, and how even government ministers get involved on their personal social media profiles, and how difficult it is then to verify and call people out, because there's this distinction that people make about what you do on social media and what you do in your department. So more and more the range of complex issues coloring the landscape in which we operate have become a lot more, like I say, complex, and therefore navigating this space has become a lot more difficult. And so the big newsrooms that we are compelled to also cover other stories. So we don't necessarily have the investigative capacity, for instance, like a unit like Amabungani or Scorpio or Daily Maverick. And the criticism of these investigative journalisms have always been that it only looks at the public sector. Yet, if it wasn't for journalism making the links with the private sector through the Gupta leaks, for example, and other reports, much of what is emerging in the Zondo Commission would not have seen the light of day. And I think the same is going to happen around COVID. It is only with the work of dedicated teams that we are going to be able to uncover some of the underlying dynamics that is influencing the decision making around COVID, and the lack of responses that we've seen from the health department, both from a policy and directional level and from an implementation level, where we have historic issues of, for instance, to use Gauteng as an example, Gauteng hospitals being ill-equipped to deal with particular situations. Exacerbated, we've had the burning down of a major hospital in South Africa. Nothing yet has happened, and those aren't as a result of COVID suddenly striking. It's a result of existing or pre-existing conditions within the health department. And most of those things we know, even with the PPE scandals around schools and all of those things, that it is politicians that's involved. It is corrupt business people that are involved. And I think the reporting on those aspects of the pandemic has become equally important as reporting on the actual numbers, on reporting on the vaccination and the slow pace of vaccination. So yes, unfortunately in South Africa, as in the rest of the world, the global public health emergency has been largely politicized, and South Africa, unfortunately, hasn't escaped it. And I think, in fact, us being a country with such a highly politicized society and such a highly politicized body politic, it was almost inevitable that these two issues were going to merge into one. What is going to be interesting, Mia, is how, if we have the elections, because we're obviously waiting on the Moseneke report about the viability of local government elections going forward, but just what kind of role this pandemic will play in even hosting and campaigning around local government elections. So the infusion of politics into the COVID situation, or vice versa, if you like, have given us a whole new scenario of how to look at stories, what to choose from, and in fact, what the priorities are in terms of reporting. Like I said earlier on, I think some of the important aspects to report on are the political dynamics behind the decision making, in as much as the actual numbers and figures.
Thank you very much, Zain. Those were really great insights, and not insights that you'll always find from a health reporter. So thank you for bringing an extra dimension to this discussion, and for pointing out, so many of us often ask, how can you be so cruel to even be corrupt during a pandemic? But you've pointed it out to us that a pandemic actually creates more opportunities for corruption. So we shouldn't expect it not being there. Before we move on to our last speaker, I would like to remind you that if you have a question, please enter it in the chat box. We've received quite a few questions from you when you registered, but questions that you're going to pose right now is also very welcome. Now, to end off, we're going to end off with someone from Bhekisisa, Aisha Abdul Karim. And Aisha is a health reporter who started her health reporting career last year in January. So January 2020, and 6 weeks later, there was a pandemic. She came from the Daily Maverick as an intern, and then she walked literally into a pandemic. And since then, all Aisha has been reporting on is the COVID pandemic. And she's become known for specifically focusing on the science of COVID and breaking that down in really creative ways. So Aisha, you were an intern, then you became a health reporter, and you reported on COVID. What, as a reporter who reports on the science very often, what is the latest in the science when it comes to vaccines? And what has been your challenges with breaking down science and reporting on science with COVID, especially science that can be really complex and that moves at the speed of light?
Yeah, so I think as Mia outlined, I basically came into health reporting in January last year and wrote my first story about COVID in February last year. So it's been almost a year and a half of just constantly trying to keep up with the latest science on COVID and trying to figure out where our focus should be in terms of coverage. I think in terms of the challenges around that, I think one of the biggest struggles has been trying to figure out where we need to be as the pandemic progresses, because at the beginning of last year, as some of the other speakers have touched on, there was very little known about COVID. So the stories were much more simpler in trying to get a handle on what we do know and what we don't know. And as the pandemic has progressed, there's been new science coming out regularly, there's been new developments, and the issue has become much more complicated, and there's multiple different facets. And I think one of the biggest lessons I've personally learned is that you actually can't know everything about this virus. You really have to pick a lane and stay with that. And so my areas of focus have had to change from trying to stay on top of everything that's coming out to being much more focused on staying on top of vaccine science, staying on top of the vaccine rollout, and really becoming much more niche as we get further into the pandemic. And then in terms of breaking down the science, I think one of the challenges there was, it was almost comforting to be a newcomer to health reporting at the beginning of last year, because it was a space where there wasn't a lot of knowledge coming in. So it wasn't super intimidating to try and speak to people and try and understand very complicated science, because it felt like we were all sort of figuring it out and learning together. And as that progressed, it sort of felt like I got to build my baseline knowledge along with the scientists and the science as it was developing. And so once I understood the basics, I was able to keep up with like the more complicated developments as they were arising. And I think the role of scientists and the researchers who are, really trying to stay up with these developments and that are producing this research and doing the work wouldn't be possible without those researchers giving us their time and them also learning how to break down what they're doing in a simple way that is understandable. We've touched a little bit, I think some of the other speakers have touched on the difficulties with the science becoming more political. And I think that's been one of the challenges also when it comes to selecting who you speak to, because I think one of the issues particularly, and I think this was particularly more prevalent last year, where I think there was a difficulty from experts not knowing how to say that they can't answer a question. And so as a reporter, you have to also be up to date enough on the science to be like, okay, what this person is telling me doesn't necessarily apply. And you also have to get to know the different fields of science really well so that you know what component of the field and which is the right expert for you to speak to for your story. So for instance, when it comes to the vaccine coverage that we've been doing, there's multiple different stages of it, and every person you need to speak to is different. So if I'm trying to understand how vaccines work in terms of like how they're working in somebody's body, I need to speak to an immunologist. If I want to understand how the clinical trials are running, and if I want to understand those results, I need to speak to somebody who's working in the trial space. And so that was also sort of like a learning curve of trying to figure out who is the right expert to speak to and who has the best knowledge for the story that I'm trying to write. And I think there is also, as we've moved on, I think there has been a bit of blurring of lines between what is the role of scientists and experts and how they factor into political decisions that are being made. I think one of the biggest points of confusion in that arena was the creation of the ministerial advisory committees. Because I think from a public point of view, there was a lack of understanding of what advisory committees do, and the fact that these committees are not, they're there to offer advice, but they're not actually making political decisions. And so sometimes there were political decisions that were being made that were informed by science, and sometimes there were policies and regulations that were implemented that didn't necessarily have evidence or science to back them up, and that maybe weren't coming from these advisory committees. So I think that was also something to balance in coverage, is to know, like, when is something coming from a scientific background and when is something coming from a political sphere, and trying to distinguish when there's political influence behind a decision, and breaking down when there's actually scientific evidence supporting those decisions.
Thank you very much, Aisha. Thank you for bringing together, from a different perspective from Zain, but like the politics and the science together. And I think there are few things as intense in the politics world as scientific politics. So thank you for highlighting that so well. We're now going to move on to questions and answers. And I'm going to start off with a question of Marilyn Keegan, because I think it's an issue that everyone in this panel experiences, and that is access to information from the health department. And it's tough for us because there's not a consistent way of communicating. Often if you need information from the health department, if you're going to go through the formal channels, like, go through the spokesperson and then waiting for an answer, it's going to take you an awfully long time during this pandemic. So I would like to ask Mkhlatsi and also Heidi, Marilyn's question: how do we get them to give us more information? Do we go through SANEF, Mkhlatsi, or how do we get them to just do this in a fashion where information is consistently and more easily available, and where we don't have to make 10, 12 calls or know someone in the health department that you can phone directly who's not supposed to be phoned? Mkhlatsi, let's start off with you. You run a newsroom.
I think this is why Digital Vibes was so painful for all of us because, we were all so frustrated about the lack of information that has come through. And I've heard that frustration also even with the provinces themselves, where they also do want to share information, but because with this pandemic, things have been centralized at national department, they're equally frustrated by that process. I think it's actually quite disappointing that communication has not been prioritized by our government, because you shouldn't have to depend on your contacts and also the people that work in the department that are not official communicators to get information, because when you're dealing with the pandemic, the media plays that vital role of helping inform the public. And at the end, you would need the media to either drive your vaccination campaign or to even drive your education campaign in terms of prevention. And I think we all share in that frustration from government. One of the things that I unsuccessfully have been fighting about is this random release of the times for the numbers in terms of how many people have actually been now vaccinated, but also then in terms of being tested, because it would be at some point in the middle of the night. And often it used to come with no commentary, just so that you help people that are not very much health specialists and are able to understand numbers to make sense of those numbers, because you need to understand, does this figure represent 20% of the people that are testing? Does this figure represent how much of the elderly that is being vaccinated? I think a lot of people have not understood how low the vaccination drive has been. And, I can say that we use SANEF, but I think we all have media platforms where I guess we're at a point where we are so frustrated and we need to start writing and calling out the health department where they are not giving us the information. I think that is the only way out, because we have also behind the scenes made our own push for more of that information to be released, and especially for community media that is so critical in this campaign. And we have said this repeatedly, that many of us who are mainstream have other ways of getting the information. But this pandemic, to be won, And for the communication, you need community media who don't have the numbers for the DDGs, the director of this and this and that. And you need to have a government that communicates. I think GCIS at some point tried to play lead in this communication, but then the health department wanted everything centralized, and then that became a huge problem. And I think if there's anything that I think for me, the Digital Vibes campaign or the corruption around it that frustrated me was that it did not help in helping the government communicate better at a really critical time. And what it was just stealing.
Thanks, Maglatsi. Heidi?
Yeah, I mean, it's not been easy at all. And I've reached a point now where I actually go live on air and I say, unfortunately, we have not received a response. And it's not the ideal situation. And, you know, sometimes you get calls from the department to say, you know, why did you say that? Or, you know, you should have just given us a little bit more time. But when people are in ICU or when people are, you know, going through the most, it becomes very difficult to not have that information available. So that's what I do. I go on air and I say, unfortunately, we don't have that information available. For example, you ask Gauteng Health why Nasrec was decommissioned. And, you know, we're in the middle of a third wave. Gauteng numbers are extremely alarming. They tell you, no, there are enough beds. Whereas you speak to the private sector and you speak to actual doctors on the ground in these wards, and they tell you there are no beds, people are being turned away. So it becomes extremely frustrating. And if I can say anything to government, it's please provide us with the information. And you'll hear after these briefings where they say, thank you for the media for playing such a crucial role. And it's like, but you're not helping us with the information. We can play an even better role if this information is provided. So I've hit many walls. I've become very frustrated. I've raised my voice sometimes to these officials to say, we need the information. You actually need to give it to us. So, you know, the challenge remains, and we try our best to provide as much possible as long as it's provided to us.
Thanks very much, Heidi. We're now going to look at a question that we received during registration, but also combined with one of Tiffany Jackson Zunker that was asked on the Zoom channel. One is, and I would like Zain and Aisha and Estelle to respond to this question. The one is, how much interaction did panelists have with Digital Vibes people in the past, and are they still active in the media and communication space? And also, how do you deal with the politicization of experts, especially now that stories are becoming more politicized, in the sense that vaccine rollouts are all about who has access to vaccines and who don't, and where do we buy them from, and what kind of procurement deals have been made. What would your reaction be, Zain? Let's start off with you as a political person.
Just on the question about interaction and contact with the Digital Vibes people, we haven't had any, other than we've made an attempt to have them on air to give their side of the story. We've actually approached, but with no success and to no avail, for Digital Vibes directors to come onto our channel and to come and explain their side. That hasn't been successful as yet. And that again is just an example of how communication or rather traditional media houses are just being cut out of information, where people don't feel obliged to be responsible and to be held accountable. And I think that lead, like Maglatsi has said earlier on, is coming from a government, because more and more we see, not only with the health department, EMEA, but I would like to suggest that across the board, it's becoming more and more difficult to extract any kind of information from any department, that for that matter, and from political parties about their own plans. We are living, unfortunately, in my mind, in a post-truth situation, where if you repeat a certain statement enough times, it becomes the truth. And all you have to do is create a reasonable doubt, We've seen some of these stories in the media in the past few weeks that lends itself to that kind of example. And so yes, newsrooms have to become a lot more resourceful. We have to create our own experts. We have to almost become little investigative units, which we don't have a lot of time for and a lot of money for, to be honest. So given those kinds of constraints, it is becoming a lot more difficult to access information. And I think it was always going to be the case that the issues around COVID was going to be politicized, given the fact that this rollout and most of the responsibilities and the issues that are meant to are for accountability are in fact government and government institutions that are responsible for these rollouts and for these processes. And I think even before COVID, like I said earlier on, we've been experiencing problems of access. We've been experiencing problems where the only way, or sometimes what institutions and bodies do, is to just put an alternative view out there on social media, put a binary option out there as reasonable doubt. You create a little bit of fanfare around an issue, and you attack people's personalities or their own or their personal traits or their personal their personalities, rather than the stories and questions that they are asked. So a lot of times you've seen the attacks on journalists increase, especially those journalists who are asking critical questions. And I think those kind of situations are going to increase. But that is the kind of scenario and dynamic that we are dealing with as newsrooms in terms of accessing government and even corporations for that matter, because I would like to make it clear that what these little investigative units have shown us is that there's a corruptor and a corruptee.
Thanks very much, Zain. Before we move on to Aisha, I'd like to read a comment of Ashraf Garda. He says, in the light of the breakdown in effective communication pipelines to journalists from the health department, it is about time that journalists of all media publicly issue a statement backed by a memorandum calling on health authorities to open up. It is a desperate time after all, and citizens are bearing the brunt of misinformation. Thanks very much, Ashraf, for your comment. Aisha, let's move on to you, and let's relate that to reality at the moment. On Friday, we have an EFF march to SAPRA, our regulators' offices, that's going to demand that they make vaccines that have not been approved, for which we don't have enough data yet to approve, are made available. And you report on the science behind that. How do you deal with this and prevent the story from being politicized?
Yeah, so I think that as we sort of touched on, the issues are sort of getting a bit more blurred between science and politics. And so it is one of the challenges in terms of how do you approach these stories. I think the first aspect to note is that I think when we think about health journalism, it maybe sounds like it should be very straightforward and very focused on science. But one of the things to realize, and I think it's one of the things that the pandemic has also helped highlight, is that the health sector doesn't operate in isolation. And so you have to really be aware of where it's overlapping with other areas and other sectors. And one of those sectors is politics. And so I think it's definitely helpful to stay on top of politics. And it was useful to me to come from the Daily Maverick, having a bit of experience and background in politics and being able to apply that to health reporting so that you're coming in with knowledge of that space already. In terms of the actual focus of the stories, I think for us and for me in the stories that I'm taking, I think it's much more important to not let the politics distract from the science and from the story. So the EFF is one example. It's definitely not the first time that politics has entered this space. And I think it, as much as the politics influence what's happening and are a part of the story, they shouldn't be dictating the story. And I think the role of Bhekisisa's coverage and what we're working on is really to try and separate out the facts and the evidence behind what's happening. And so in this case, it's really focusing on how vaccine approvals work, making sure that people understand the information that is available about vaccines, why there are potential delays to its approval, and focusing on explaining the thought process behind what's happening, as opposed to focusing on and reacting to the immediacy of what's happening, which in this case would be the EFF protests. So I think that's sort of been my approach to these stories, is looking at the underlying issues as opposed to just focusing on the politics in this specific moment.
Thanks, Aisha. Estelle, let's move on to you. In addition to the political situation, I would also like you to comment on a question we received during registration on what would you do differently in making sure that more ordinary voices, so not that of the politicians, are heard in challenging government communication around vaccines rollout?
Yes, I think that's a very good point. I think we do need our community leaders, our sort of, you know, let me just maybe take one step back. It is very difficult when the health department bans, say, senior nurses, senior doctors from speaking to the press, even if it's about the science and the medicine and the hospitals. And I think a lot of our important voices in our communities, they're just lost because of this. So I think that's a major policy problem. Then I think our community leaders have been sidelined to some extent during lockdown, and it's more important than ever that we get their voices back. I think they have played quite an important role sort of behind the scenes with the vaccinations. And I'm really hoping that we can, trying to amplify their voices, because I think it is a good point. We need to know the experiences of ordinary people. You know, I've spent a few hours with the ambulance drivers the other day, and if you hear their stories, they're very much sort of the canary in the coal mine. They can see when things are going bad. And I think it would be, it's so much, it tells a story so much broader, and so there's so many more layers to the story of the third wave. We're only starting with the third wave in the Eastern Cape, but it's already having a huge impact. But the story must be told by people like the ambulance drivers, the medics, the nurses, the funeral directors. You know, sometimes, especially in the absence of credible information from the health department, we really need those voices.
Thank you, Estelle, and I would like to thank you for always making those voices heard in your stories. They really always have the voices of ordinary people, and we need to hear that. Before we move on to the next question, Mkhlatsi has made a really interesting point in the comment boxes, the chat section of the Zoom screen, and Zain has also made those points. Mkhlatsi said, I think health in South Africa and in the world has always been political. Think about the AIDS pandemic and ARVs, the politics of access, politics of who provides the vaccines. It would never be possible to divorce politics from the pandemic. We have to cover all aspects. That's such a valid point. Thank you very much, Mkhlatsi. I'm now going to ask Heidi a question, because one question came in specifically for her, and that is, Heidi, how do you manage to break down statements and analysis so brilliantly for ordinary persons to understand? And how do you memorize all those numbers you're faced with daily?
It's very tough. It's not as easy as it looks. A lot of the time I write it down, and I always have a notebook in my hand. You will always see a notebook in my hand when I'm live on air. In case I forget, I'm human, I make mistakes. But I've just tried to master looking at statements very quickly, and I've made mistakes. I'm going to be honest, it's not easy. And then I try to delete the tweets to make sure that my information is correct. But you know, it's just about providing the information as quickly as possible, as soon as it comes out. The information that we do eventually get, I try and distribute that as quickly as possible. You know, a lot of people say, I don't know how you type so fast. It's crazy to look at, but it's just something I've mastered. And I think with all the numbers coming out, and with the fact that we are in the third wave and Gauteng experiencing such high numbers, I try my best to be always engaged on my phone, looking at when the numbers are coming out. I have alerts to say there's a statement that's dropped. And I get excited when information comes out, because we don't normally get that. We have to wait hours. And what's interesting now is the NICD is starting to release COVID-19 numbers before the Department of Health, which I don't think you know, should be the case. The Department of Health should actually be releasing the numbers before anybody else. But I have alerts, and I try my best to inform everybody as quickly as possible, of course, without making any mistakes.
Thank you, Heidi. Those are very useful tips. We're going to move on to a question about fake news now. Someone asked, panelists, can you please cover fake news and its consequences in the general population? Now, I would like to ask Estelle and Aisha to respond to this, because it's tricky to cover fake news, because you run the risk of amplifying the fake news instead of addressing it. So how do you approach that, Aisha, to not amplify the wrong things? And Estelle, how do you do that on a grassroots level in the Eastern Cape? Let's start with you, Aisha.
Sure. I think this is sort of similar to my previous answer in terms of the approach to the misinformation. It's that you have to be a bit more selective in terms of which stories you choose to focus on and where your attention should go. I think obviously when it comes to misinformation and disinformation, you have to be really cautious about not amplifying something that doesn't already have attention, or that isn't really causing isn't causing any trouble already. And you have to make sure that what you are addressing is something that needs to be corrected because it's already in the public space. When it comes to where I've chosen to focus my attention, a lot of it last year was focusing on medical misinformation, because those kinds of myths and that is harmful to people, because it's in terms of encouraging people to take medication that we don't yet know the consequences of, and that in some cases is not legal for use in the country. And so that's sort of how I filter out which rumors to address, is when it has the potential to cause harm to people, and when it is becoming more prolific in terms of what people are paying attention to and what is being picked up, and filtering that out from sort of myths and misinformation that has less power to do damage to the public. So that's sort of been how I've chosen which stories to focus on.
Thanks, Aisha. Estelle?
Yes, I think it is difficult. I think it's you must make that choice very carefully. We are seeing the rise of a lot of fake news from the churches in the Eastern Cape at the moment with regards to vaccines. It's a difficult thing to report on. You have to be tread carefully, because you you might be accusing a pastor or somebody like that of serious putting seriously wrong information out in the public sector. I think I usually just double check first that it is indeed fake news, and if since I'm here in far-flung corners, that I haven't missed something. But then I think you have to interrogate the source. Can we find the source? What is the motivation of this person? If it's a pastor, especially in some of our rural areas that are running these COVID sort of healing services, is this the reason why they don't want people to be vaccinated? What is the reason? Do they just want to scare people? Is this just a hoax? So I think once you get to try and interrogate the motive of the fake news and why it's being sent out, I think that makes it easier to make a decision whether this is something that we cover or if we will just let it be drowned by the next day's information.
Thanks, Estelle. And on that subject, I learned a really great lesson on how to report on fake news from Twitter, actually, from a New York University professor, Jay Rosen, and it's called the sandwich message. And it means that you basically always start off with the correct information and then only after that mention the wrong information. So if a church leader in the Eastern Cape says vaccines don't work, you're going to start off by saying, vaccines work because here's what the science says, yet so-and-so says it doesn't work. And then you mention another fact about why it works. And research in the media has shown that that technique results in fewer people taking up the wrong message, if you sort of sandwich the wrong message between the two right things. We've got about 10 minutes left. I'm going to end with Mkhlatsi and Zain, but before that, I just want to read a comment here because it's a really useful tool. Michael Salzwedel said here in the comment box on Zoom that Internews, which is a media development organization, has produced a training course, Let's Talk Vaccines, the course is called, and it's specifically for journalists looking to improve their knowledge around vaccine science and research and logistics about vaccines. So please feel free to enroll. The course is on the Internews website, and the website address is also there in the chat box if you wanted to access it. Bhekisisa also has some courses that we've presented previously on our website if you are interested. Now, I would like to end with a question that I think is going to draw all of it together because it's a practical thing and it's a question for people who run newsrooms, such as Mkhlatsi and Zain. Mkhlatsi and Zain, how are you going to cover Friday's EFF march to the SAPRA offices? We're going to have a political party that has a lot of influence. They're going to march to a regulator's office, and they're going to do it in a fashion that I hope is not more than the number of people that's allowed to do it. But what are you going to do if they exceed this? Because we know Julius Malema has also mentioned that he feels because there's no access to vaccines, he won't necessarily follow all the regulations. How do you cover a story like this so that you still make the science heard, because SAPRA is a regulator that looks at science, but you also recognize the frustration out there that vaccines are not becoming available fast enough for people to feel very recognized? Let's start with you, Mkhlatsi.
Okay, before I just conclude, I just wanted to say something around, fake news and how far we go as media houses, because I find that sometimes in our fear of amplifying, we miss the conversations that are happening in family WhatsApp groups, in bars, etc. And one example I will give is something around whether steaming helps or not, and sometimes it is important that we reflect on those conversations, because these are conversations that have gripped our society. And because people live on social media and WhatsApp has become that communication tool, when the media has the capacity to explain the science, then we should actually find the time. But I know that, with all of the fake news that is out there, we just don't have the capacity to basically put out the other version of events or the science behind the story. But it's always that difficult balancing act in terms of, which one do you lift so that you can force a conversation and inform, because sometimes when there isn't the other side, there's nothing that is countering the information that is prevailing out there, especially because a lot of that information starts with, this is from a doctor in some country who is dealing with a lot of COVID patients. So that's just what I wanted to add. We have actually discussed the story on Friday around the march. The one thing that is quite clear, and I'm hoping that SAPRA also plays ball, is to actually explain the process of registering vaccines. I think a lot of us in our different media houses have already asked the question, why is it that Sputnik and all the others are not yet registered? So that they can explain the process and be very clear about the communication. Because if they dismiss this as a political realm that they don't want to enter, then they're going to allow for a narrative from a very influential political leader to actually dominate the conversation. I think that the questions around the Russian and the Chinese vaccines have not only been asked by the EFF, but it's also quite a point of conversation within the ANC as well. And a lot of it happens because of the political background and the political connections between Russia, China, and South Africa. And that is why this conversation is happening right now. And it's important that the regulator maintains and communicates to the public what steps has happened and what hasn't happened that has not allowed them to register. And it's, you know, it's actually, it would be, if they were to go silent, then they will not be doing their job as a regulator. Sometimes you're forced to enter the realm of the politics as a regulator so that people understand better. And it's those stories where, you know, when you send out a reporter, your heart literally is in your mouth because you're worried about your reporter and how safe they are. But we will definitely be sending people out, and we will be reflecting on whether they are violating the regulations, and ask Julius Malema why. You know, the big question is, you know, you are saying that you're trying to save people, but then you are creating a super spreader event potentially that puts people's lives at risk when we actually are nowhere near in getting the right number. I think that the media has done quite a fantastic job of putting pressure on government and saying, you know, why has it taken so long to actually distribute the vaccines? We know some of the bad luck that we have experienced as a country, but some of it has really been from just an administration that started way too late and then often goes into silence and waits until, you know, all of us are about to say the words that we shouldn't be saying in public to actually explain what is going on. But I think we can't ignore the story. We have to cover it, but make sure that it is balanced with all the views. But it's important that all of the other players make themselves available to actually answer those questions.
Thanks, Mahlatsi. Excellent points. Zain, how is your television newsroom going to cover this event?
Hi, thanks, Mia. Without giving away too much of how we've been treating and how we intend to treat the story, we already yesterday spoke to Sapro, who exactly did what you were talking about now, Mahlatsi, is to explain the process. We've had them on today. We even had Julius Malema on this morning speaking with Xoli Ngambi, where Xoli posed the question about kind of like the logic of having an event to mark for vaccinations and to keep people safe by exposing them to the very virus that you are wanting vaccination for. Julius's answer to that was that we're already living on our knees and that this wouldn't make too much of a difference. Be that as it may, as a newsroom, we cannot miss such an event because of the potential, the news value in that story. If we have more than the stipulated amount of people in terms of the regulations, because remember we are in lockdown level 3, if we have a gathering that is more than the stipulated amount, it becomes another type of story where we have to report on it becoming a potentially illegal gathering. I've read in one of the comment section that the concern is important, and yes, the concern around vaccinations must be ongoing, and we've been treating that with several experts explaining to us the differences between the vaccination processes and the validation of those processes. So that is some of the ways in which we will be treating. We will continue to unpack, illuminate, and explain some of the key scientific, like Aisha says, the key scientific issues, because I think in this instance, if we deal with facts and we deal with facts only, it's one of the ways to separate the fake news, but it's also one of the ways, the best ways to treat the story. The story is multidimensional. Like I said, there's a political party that might just break the law in terms of the mass gatherings that are allowed under the legislation, and also the concern that they are raising about vaccinations is becoming a big concern because it's on the lips of everybody. Why are we accepting certain vaccinations quicker than others? But more importantly, why aren't we getting vaccinated at a quicker pace? Because I think that becomes the big story for us. So definitely, like Mahlatsi also said, it's the kind of story that you, as an editor, are very cautious about, because one, we are putting our reporters out there in a situation that might endanger them. They then come back to the newsroom where a whole newsroom then becomes at risk. So these decisions are not taken lightly. And when we do take them, it takes a great amount of production and preparation to make sure that firstly, our reporters are safe out in the field, and that secondly, we cover the story as guided by our editorial policies.
Thanks very much, Zane. I think that's a great way to pull this conversation together and to end our webinar. Before I go on to thanking people, I do want to read a comment of Marina Hubert. Actually, it's a question for panelists, but we don't have time left for that. But it's also a really great story idea. And Marina says, what do we think about the idea of giving people incentives, so free food, lottery tickets, that type of thing, to get vaccinated? Is it ethical? Could it backfire and make people even more suspicious? Or is it a brilliant way of making getting people to vaccinate and making the vaccination a more positive experience? And it's interesting if we look at the United States, where there were some particularly conservative states where there was a lot of vaccine hesitancy and there were lotteries offered to people. You could enter like $1 million lottery if you got vaccinated. And that actually helped in some states. But it's a very interesting story idea to look at. Is it ethical? Is it not? Does it work? Does it not work? So before we end, I'd like to thank our really amazing speakers, Zane, Aisha, Mkhlatsi, Estelle, Heidi. I know you have many, many deadlines and that you really had to shift them to make time for this. And we really appreciate your insights and also your honesty in sharing your experiences of reporting on COVID and how you make decisions. It's really highly appreciated. And I'd also like to thank Rosalind Daniel and Kgopolang Magau from Bhekisisa for organizing and promoting this webinar, and Joan van Dijk for her really great live tweets during we having this webinar. And if you'd like to listen to recording of this webinar, it is on Bhekisisa's website. It's already there. We live streamed the YouTube link from there, so you can access the recording there. And we'll also publish a summary of the webinar within the next week or so. So thank you very much, everyone, for joining us. If you'd like to join our next webinar, it's going to be in July, and it's going to focus on what lessons we can learn for our national health insurance from the COVID pandemic, particularly from our vaccine rollout. So keep an eye on our Twitter account for dates and times for that. And thank you so much for all the participants staying with us throughout this webinar. We've seen a consistent number of over 100 people joining us via Zoom during the webinar. Until then,